Okay, so welcome everyone to our first webinar of 2025. I hope you all had a wonderful holiday season, and we are thrilled to have you join us today for what promises to be an insightful session. We are honored to welcome Dr. Renata, a highly respected dermatologist from Brazil. Dr. Renata will be sharing her experience with a very exciting combination with the Intensif and the Profhilo. So thank you, Dr. Renata, for taking the time for being with us here today, and please proceed.
Hello, everyone. Thank you, Azhar. Thank you, EndiMed. Hi, everyone. My name is Dr. Renata Violato. I'm doctor here in São Paulo, Brazil. And I'm very excited to share with you my experience with EndiMed, specifically this time about Intensif and its possible associations. So a little bit about me. I'm a doctor, graduated from ABC's Medical School of Medicine. It's in São Paulo also. And I graduated in 2005. And I have been practicing as a dermatologist since 2011. And nowadays, I'm a clinical supervisor of the laser and technology ambulatory in the same place I have studied and graduated. So I'm really passionate about technologies and natural results. So I'm thankful for being here. And just before we start, I would like to make a special thanks to Marceli. She does a great job here in Brazil, represents EndiMed very well, giving support to the doctors. So we developed together some protocols, and some of the patients you see here, she developed with me. So EndiMed is a platform we all know that allows a complete aesthetic solution. We can treat the whole body as well as the décolletage and neck and face. And it has many tips. And so each tip has his own depth. And today I'm gonna dive into Intensif, and it goes like 5 millimeters of depth. So just for us to be on the same page, I'll talk a little bit about radio frequency and microneedling. So RF is able to hit the tissues, right? And when it reaches about 52, 55 degrees, it triggers fibroblasts and collagen remodeling, right? So when we perform RF to achieve this temperature on the dermis, we observe that on the skin surface, we have like 42 degrees. So it's already okay for us to have the dermis heat that we need. And just remember, radio frequency goes deeper than the light device, and we can apply it to any phototype. So nowadays, we have different kinds of RF technologies. And today, I'm going to talk about the 3D technology. That's the Endemeds technology. And that's the one that I like. So just for you to know, I have Endemed like for 3 years now, I guess. We use it a lot on the clinic, like the contact tips and the microneedling one. I just love them all. So 3D is a multi-source phase control RF. It has 6 generators, and they interact among themselves. And when they do it, the positive and the negative poles, they interact between themselves. They create a barrier that goes deeper and deeper, protecting the epidermis. So it goes deeper without the heat on the surface on the skin. So that's very safe. And this way, the energy concentrates and only on the dermis, and the temperature stay like 52 to 57 degrees, and that's what we need for collagen. And the frequency is 1 megahertz. So this video illustrates my words. We can see how it works, the 3D RF. It has constant circulatory movement. It's very comfort for the patient. On the next slide, I'll show you some real-life application on one patient of mine. So you see that she's very comfortable, no pain at all. We don't have to cool, no need for cooling. And we have minimal or no downtime. I'll show some pictures of this also. And studies have shown no harm with side effects. So this device is very safe and very efficient at the same time. And here is a thermal experiment where, and it shows that 3D goes deeper than the other types of RF. So on the 3D video, you can see that the heat goes deeper than the other one, that is bipolar in this case. So now, I'm going to talk about a little bit of the fractionated pulsed mode. Oh my God, I guess just a second. I guess there was one missing. I don't know why. Okay, so I'll just talk. So now, let me just see if I can. There's one slide missing. But okay, I'll just say it. Now we are moving forward to microneedling. About microneedling, there are 2 types of technology. The insulated one, where the energy goes only on the tip of the needle, and the non-insulated mode. That's the one that Endemeds use, and that's the one I prefer because coagulation goes with all the depth of the needle, and there is no bleeding on and we have a very safe mode. I speak specifically about intensive, that is the fractionate pulsed mode. Let me just put the video again. Okay, So when the needle enters the skin, the RF is released only after, so the epidermis is spared, even though the energy is released throughout the needle. So in this video, you can illustrate that. So there is no epidermal coagulation. And another important differentiation is the way of the inserting the needle on the skin. It's very gentle because it occurs in a less traumatic way because of the motor control. It's motorized, so it gives us less trauma, less pain, less downtime, and decreases the chances of hyperchromia. So going more technical now, intensive tip, it has 25 microneedles, and the needle body is 300 microns in diameter. However, the needle tip is thinner, and this is another reason why that makes the treatment less painful. It's gold needles, and each disposable tip has 1,000 pulses each. And we can make digital control of parameters. The penetration goes up to 5 millimeters. The power goes up to 25 watts. The pulse duration goes from 50 to 200 milliseconds. And one of my favorite features of this device is the possibility of turning off the radio frequency. So we can expand our range of treatments for hair and melasma. I really like these two treatments. I do it a lot on my clinic because it's less painful than rollers and you can guarantee the chosen depth. So like I said, intensive has a short downtime. It's the post-procedure has a quick recovery. And in my clinical practice, I observed that the skin is already recovered in between 24 to 48 hours. So it's very quick. Patients like it a lot. And just before I show you some results of mine, let's do a little talk about one of the possibilities of association with Profhilo. Profhilo is a pure hybrid complex of hyaluronic acid with high concentration of high and low molecular weight hyaluronic acid. It's thermal stabilized and with high spreadability on the tissues. The interesting point about this injectable, is that it has a bioregenerative multi-level action, and it acts on all layers of the skin and on the subcutaneous, and it helps with hydration and rejuvenation. So why intensive and Profhilo together? Because each one has a different mechanism of action on the skin, so one complements the other. So this way we get the best of each treatment. That's one thing I do all the time here in my clinic. I mix procedures, always making safe, maintaining safety to the patient, but getting the best of each one. So when we add them together, we get best results and superior results comparing to single ones. And another thing is we speed up the process of tissues improvement and amplify and improve the nail collagen. Starting the cases, finally, This is an Italian case report from 2017 showing the improvement of sagging and stretch marks on the buttocks with association of intensive and profile. The protocol was four sessions of intensive, one per month, and on the first and the third session of RF, they did it right after the application of Profhilo, 3 ml per site per session. And there was 2 sessions of Profhilo on the first and on the third session. You can see the improvement of the sagging, the stretch marks. And now I'll present you some cases of mine. This first patient was bothered with sagging and horizontal lines on the skin of the neck. So I proposed the associated protocol of intensive with Profhilo. First, I did the intensive tip with drug delivery, and then injected Profhilo. And in this case, I'll show you some results of just one session. So just for you to know, this is the drug delivery that I used. It's the Firmin cocktail from Tuscany. It has DMI, vitamin C, and elastin, and it activates the synthesis of collagen and elastin, and it's a powerful stimulate of fibroblast activity, and it also has all the benefits of vitamin C. So here in the first video, we show, the first video shows the device and adjusting the parameters, the depth, the pulse duration, and the power. I'll show you on the next slide the numbers, right? Just for you to see the screen and how is the machine. Here in the second video, you can see that each chip comes sealed, sterilized individually. Each patient has their own chip, and I'm easily placing it on the handpiece. So you can see here, okay, just putting it. So this is the device, the Endimedi Pro, this one. Oh, sorry. And here on the third video, when I start the session with the, then I start the session with the first application of the drug delivery solution on the skin. Why do I do this? Because when I perform the microneedling, it will already push the liquid into the skin before releasing the RF. So that's one way to guarantee the best absorption of it without the heat. So when applying the intensive tip, you can see how it enters the skin so gently. The patient is only under topical anesthesia. In this case, I used a cream with 5% lidocaine, like 30 minutes earlier. And then I removed it, disinfected it with chlorhexidine before all the session. And this is the parameters I used on this case. Like depending on the thickness of the skin, I choose depth. So in this case, his skin is a little thick, so I chose 2 millimeters. I go from 1 to 2 millimeters, it depends. The pulse duration is 80 milliseconds. and the powers, it's 10 watts. First, I did one general pass, all of the neck with the intensive on these parameters. And then I did a second pass only on horizontal lines. And I use on this session, total of 500 shots. And the drug delivery, I like to make this way as a sandwich. So like you saw, the first application I did before starting the microneedling, and then I do the microneedling, and then with the holes on the skin, the little holes, I just do it again, another layer, using the same solution. And I have no conflict or interest about Tuscany, but I really like his products to drug delivery. Okay, so once the intensive tip and drug delivery are completed, we took a 15-minute break where we cooled the patient with a Zymer, the patient's skin, just to ensure that high temperatures would not remain on the tissue because Profhilo, like I said, is thermal stabilized. And so just to guarantee it will work well, right? And then I just clean the special point where I insert the needle with chlorhexidine to not remove the drug delivery, the solution. And then I start the application of Profhilo. It was made by 10-point BAP technique for the neck. It's described on the literature. It's the point. It's you can see on this picture how we distribute on the neck, as the image shows. But in this case, here in Brazil, we like a lot to personalize the treatment. So I decreased the volume per point to from 0.2 ml to 0.15 ml. So I have a Profhilo left over to be applied in micro dots directly on the horizontal lines of the neck. Okay, so this is the immediate post-procedure. And in this case, the patient was my secretary. So I observed that in about 4 hours, she had no marks from the procedure. So it's really quick recovery. And in this video, you can see the improved skin firmness and horizontal wrinkles with only one session and in 20 days. This is a 20-day after picture. So let me show you just one more time the video. She was very happy about the results, like in less than 1 month. This is the parameters again that I described. So one picture on the front where you can see the results. Lateral picture. And this is another patient, an older woman, to compare from the previous one. I use the same protocol because the thickness of the skin was like the same, even though she's older. And the interesting thing about this picture is that you can see a 4 month after results and it's a long-term result. So we can see that we have really quick results and it maintains during the time. Okay, on the front, really improving the lines and the sagging. And this is a video, show the whole thing. She was very happy also. This is only one session also. This is not about profile, but it's still about intensive. And this case, I wanted to bring here to show you the results of another successful association protocol that I have in my clinic. In this case, I use Radius Plus for biostimulating. Immediately after, I apply intensive and the drug delivery as a sandwich with exosome solution. In this case, I use exosomes from ExocoBio. So this is the results of two sessions. It's 4 months after, showing the improvement of acne scars. There was an improvement with only two sessions, which I think is a good result for acne scars in such an interval and for a few sessions, because we all know acne scars are very difficult for us to treat. On the first session, I used 2.5 millimeters, and on the second sessions, I were more aggressive, and I went to 3 millimeters, and I make it more powerful, like increase the watts and the milliseconds. So when we increase the milliseconds, we stay longer time with the energy on the skin, so it goes really hard. It's 500 pulses each session. So the video showing the results, he was very happy about it. His self-esteem was like so high after this. I was very happy, and he also. I just put it one more time for you to see. Okay, so at last but not least, I bring you two cases of good results with contour. Contour is another tip that I really like in EndyMed. I use it a lot here in my clinic for cellulitis and skin irregularities and the treatment of the sagging in large areas of the body. So this is an abdomen, the imaged post-procedure in only one session. So you can see how it goes flat. And for Botox, I really like contour either because we also see a lifting effect. Here in Brazil, women search it a lot. So I use it a lot in my clinic. Sometimes I associate with Radius or Sculptra. And first I do the RF, and then I do the biostimulators on the end of the sessions. I usually do 4 to 6 sessions, each 15 days. In this case, we see the results of only 3 sessions, and I did not use any biostimulators. It's only the device. So, as we saw, EnzyMap gives us a complete range of aesthetic treatment solution. It's all in one platform. We can treat face and body. We can do fractional. We can do more invasive procedure or only just contact procedures. It helps a lot of things, especially when we refer about stimulating collagen. And it has many publications in prestigious journals. So that's really nice. That one thing that I always search for, I guess all of us doctors. And I want to thank you all for being here. I'm sorry about my English, and I'm here to answer some questions. And thank you all, and thank you, Edmund, for inviting me.
Thank you, doctor. It was really amazing. The protocol,
Thank
the
you.
results, everything. It was really insightful. We have a lot of questions regarding the protocol. So
Okay.
the first one is, when you treat dark skin types, do you use the
Yeah.
neck? Do you use the default parameters or do you change?
Okay, so let me go back here for you to see this patient. It has like, I don't know, a high phototype. I just don't like to put the power so up. You see, like I use like 10 watts. So when we do high phototypes, I don't like using high watts. The power I go like a little down. But like I said, EndyMed is really safe because it doesn't accumulate high on the surface on the skin because of his technology. So we can be really okay about it using the radio frequency because the chances of hyperchromia are really like minimal. I never had one patient with hyperchromia, and here in Brazil, we all culture mixed, so we have all the time patient with high phototypes, and I never had a single problem with hyperchromia. So it's really safe device. But even though I like to use like 10 the watts, not so high.
Great. The second question is, do you add intensive treatments after the combined treatment?
Yeah, like any combined treatment.
Like when you do the combination between the intensive and the Profhilo, is it a single treatment and that's it, or do you do multiple sessions?
Oh, yeah, I understood now. So usually I do multiple sessions, like minimal 2. In this case, it was my secretary, so we did just once to see how it goes, and she was already very happy about the results. So we just didn't do the second one. But in my patient, I proposed 2 sessions, sometimes 3. It depends of the degree of sagging and the horizontal lines or the wrinkles on the face, on the neck, in this case on the neck. But mostly I do 2 or 3 sessions.
Okay. And another question is,
And the interval is 1 per month.
great. So you spoke about using the intensive for drug delivery. Do you use also the FSR for this indication?
I'm sorry, did I use also what?
The FSR, the handpiece, the fractional.
Oh, yeah. I do like FSR, but I prefer the intensive for drug delivery. So I use it most of times. I use intensive. I guess it goes deeper, right? So I prefer. But I also use FSR also.
Okay, great. Another question is, going back to the protocol, what do you do first, the Profhilo or the intensive?
So first I do the intensive. Let me just get back here for you to see. So that's the order. First, I apply the first layer of the drug delivery solution, and then I do intensive, the application of intensive, and then I do the second layer of drug delivery solution, and then I just cool the skin with a Zymer for like 15 minutes, and then I apply Profhilo. So it's first intensive and then Profhilo.
Thank you. And the next one is regarding the indications, like for this combination, the intensive and the Profhilo, what indications can we do for the face and also for the body?
Yeah, I use mostly for the face, but we can use to the body also. Like we saw here on this case report, Italian case report, we can have a improvement for the body areas also, but I prefer for the face. It's like always to stimulate collagen and for treating wrinkles, and because each one has a different mechanism of action. So Profhilo can do the bioregenerative stimulation, and it hydrates the skin, and it creates an ideal ambient to the fibroblast to work. So it goes different about the way that intensive work, that is more about heat. So when we combine them, we improve the results. And with Profhilo, one thing that I observe a lot is that we speed up the post-procedure recovery. As with exosomes, I observe that also that the recovery is so much faster. So always talking about rejuvenation, and when we want like hydration also, because heat sometimes when we do heat, we have to hydrate, I'm sorry, the skin, and for wrinkles, for sagging, and I guess these are the indications.
Okay, great. Now moving to the next question. What combination do you recommend for treating melasma or pigmentation?
Well, for melasma, I use, like I said, I prefer to use intensive than rollers, because I observe on my clinical practice that my patients is really more comfortable on the sessions when I do the machine, the device, than the roller. Is less painful, so I prefer. So I turn off the RF, and I choose like 1.5 millimeters, like the study shows. That's the ideal depth. And with the machine, we guarantee that I will go up to 1.5 millimeters. So with the roller, we can go deeper, or we can do a shallow application. With the machine, I guarantee the depth. And what did you ask anything more? Oh, the drug delivery, maybe about the melasma. One thing that I'm using a lot are exosomes. Exosomes are really good. They help the hyperpigmentation, and I use Tuscany products also. I guess any sterilized solution about I don't know, solutions use it for melasma, tranexamic acid. I like it. I guess these things.
Okay, great. Now we have a few questions regarding the case of the where you use the radius.
Okay, yeah.
So they're asking what dilution of the radius did you use?
Okay, I diluted like 1:1. It's 1.5 ml of radius plus, and then I used 1 ml of saline solution, sterilize it, and 0.5 ml of I'm sorry, I forgot the word. It's anesthesia that we inferred. It's xylocaine, I guess. Xylocaine. Xylocaine, yes. And this is the dilution. And then I first do radius. And as the skin is already like anesthesia, and I do the intensive right after, and the patient doesn't feel more pain because it's already anesthesia. And then I do the intensive, and I do the drug delivery with exosomes. It's all on the same session.
And
And
what's the
in this case, I did 2 sessions, 1 month each. And this picture is like 4 months after the treatment.
Okay. And another question regarding the Profhilo. How long does the results last?
Only with Profhilo, the protocols are 2 sessions if you do it only Profhilo, and we repeat after 6 months. But when we associate with intensive, I don't think we have to keep applying it, and because it lasts us longer, because we add the benefits from one to the other.
Yeah, great. We have another question regarding like we have 2 machines. We have the Pro and we have the Pure. So you showed the parameters of the Pro. So people are asking, we have the Pure device. What's the power level that we need to choose? So I can answer this. So the parameters that you showed is equal to the 3rd level on the Pure. So you can choose, if you have the Pure machine, you can do the same protocol, and instead of choosing these parameters, you can choose level 3 and do the exact same steps. Now, doctor, with the last question, people are asking about other types of fillers or Botox, hyaluronic acid, PLLA. Like, how do you choose for each case the kind of the injection that you want to use? And what do you think about this, like combining these fillers or these top ingredients with the intensive?
Okay, so I have a particular way of making things that I like. I always start with devices and injectables. I really like to stimulate collagen first of all treatments generally. And first, I start with device like microfocus, ultrasound, and intensive, and biostimulators like Radius and Sculptra, and Profhilo. Profhilo I associate when I see that we have to hydrate more the skin, and biostimulators, I guess, maybe on acne scars, and when we have a high degree of sagging, when we have to really stimulate the collagen, because we have in literature one study that shows if you associate there is of one of specifically technology, but I believe that when you associate any technology that stimulates collagen, like intensive or microfocus ultrasound, or any other technology with biostimulators like Radius or Sculptra, when we do it together, we amplify the results, and the collagen stimulated, it's better. So I always start doing this, and then I reevaluate about the really if the patient really needs to do the fillers, because I do it as a complement, not as the real treatment. Because when you have bone reabsorption, or if you want to highlight some points, then I do fillers. But I don't start with fillers. I don't like it. I really love the machines, and I guess they, like you saw, they gave us really good results. You don't have to wait so much. So I always start with them, and with injectables like biostimulators and Profhilo, and only then I associate with fillers. Botox, the toxin, I guess, for the upper face, I really like it. But first, I do all the devices, and like 2 weeks later, I do the toxin.
Okay, great. Thank you so much, Dr. Renata, for your time, first of all, and of course for sharing this knowledge with us. It was really
Oh, it was my pleasure.
And thank you so much, and thanks to our all participants. It was nice to see you, and we're gonna meet next month with our second webinar for this year. So have a good day, everyone.
Thank you, everyone. It was a pleasure. Thank you, Auntie Matt.
Thank you, Doctor. Bye-bye.
Bye-bye. Thank you.
Bye.